Hello, I'm Ping Long. I'm a hospital pharmacist from Taikang Tongji Hospital in China. Before we start into prescription today, I'm going to provide some background of Chinese pharmaceutical education. This is my hospital, and this is the background of Chinese pharmacy education. The drug development process can be divided into clinical process and preclinical process. Chinese education focuses more on the pharmaceutical science, such as drug delivery and medical chemistry. Most of Chinese pharmacy students will become medical representatives and industry scientists after graduation. Until 2018, 280 universities in China have the major of medical chemistry. However, only 46 universities have the major of clinical pharmacy. Professional and knowledgeable pharmacists are still in need in China. There are 300,000 registered pharmacists in China, and they are generally divided into two types. One is called community pharmacist, and the other is hospital pharmacist. If you would like to become a community pharmacist, you should take the exam and get the registered pharmacist certificate. However, if you would like to become a hospital pharmacist, you would need another specific exam, regardless of passing the registered pharmacist certificate exam. In terms of the laws for Chinese pharmacists, there is no specific legislation. Hospital pharmacists should observe to the pharmacy regulations for medical institutes from the Chinese Ministry of Health. Community pharmacists should observe to related regulations from the CFDA. In other words, Chinese community pharmacists and Chinese hospital pharmacists are regulated by two different governmental departments. As what I have mentioned in the last slide, if you would like to become a community pharmacist in China, you should pass the exam and receive continued education every 5 years. Chinese Food and Drug Administration is responsible to hold the exam in October or November each year. What is community pharmacists? Patients should get the prescriptions from physicians first. Then, the pharmacists will dispense prescribed drugs to patients. The prescriptions can be effective from 1 month to 3 months at most. When the prescription expires, the patient should visit their physician to get the prescription again, and that can be one of the reasons why hospitals are always crowded. Nearly all community pharmacy are connected to the public medical insurance system, so patients do not need to go any specific pharmacy. In some emergent cases, patients may urgently need the drug but cannot get the prescription from physicians. Some pharmacies have enabled patients to be connected to the physicians online to get temporary prescription. If the community pharmacist is not in the community pharmacy, that pharmacy cannot sell prescribed drugs and Class A OTC drugs to patients. As for hospital pharmacists, China's Ministry of Health will hold the registered exam of hospital pharmacy in May or June. If you pass the exam, you will receive the certification provided by Ministry of Human Resources and Social Security and National Health Council. At present, there are 3 types of staff hospital pharmacists in China. They are dispensing pharmacist, clinic pharmacist, and TDM pharmacist. Pharmacists are required to do researches for promotions. In most cases, the basic income of hospital pharmacist is the 1.2 float of all hospital medical workers' average income, but it is also determined by the benefits of dispensed drugs at the same time. Dispensing pharmacists are similar to the mixture of outpatient pharmacists and technicians in the United States. They are responsible to, first, dispense and deliver drugs to patients, 2, enter drugs and report any drug quantity problems, 3, regularly check scheduled substance and report any problems, 4, evaluate the prescription monthly, especially for antibiotics and drugs which are dispensed most frequently. 5. Introduce new drugs to medical workers. 6. Do researches and instruct pharmacy students and interns. Now, I would like to provide some backgrounds on Chinese hospitals. Chinese hospitals are ranked into following categories based on their facilities and abilities. 3A hospitals are the best ones. Patients do not need to go to the primary hospitals at first. All Rank 2 hospitals are required to recruit at least 3 clinic pharmacists. All Rank 3 hospitals are required to recruit at least 5 clinic pharmacists. There have to be at least 1 clinic pharmacist per 100 patients in Ranked 3 hospital inpatient departments. In general, clinic pharmacists are responsible to following things. Some of their responsibilities are similar to dispensing pharmacists, but their tasks are more clinical. They need to, first, develop pharmacotherapies based on medical insurance. 2. Consult drugs with doctors and patients. 3. check, evaluate, and analyze prescription. 4. Report anti-infection data. 5. Evaluate and analyze the drug which come into the hospital at the first time. 6. Monitor drug adverse reaction and report drug adverse reaction cases. 7. Do researches and instruct pharmacy students. Most departments have their own clinic pharmacists. However, there is no emergency pharmacist in China now. In terms of their income, the pharmaceutical services are designed to be 4 yuan per prescription. The bonus of clinical pharmacists are determined by their clinic performance. When hospitals are going to purchase drugs, the government will recruit pharmaceutical industries along with hospitals and negotiate discounted price with industries. The drugs from eligible pharmaceutical industries will pass only one commercial company into the hospital pharmacies eventually. There is no difference between the enterprise and the sale price. In other words, there is no change of drug price when it comes into the hospitals and when it is sold to the patients. In other words, the traditional benefits from drugs themselves are low. In the past, Chinese public medical insurance will reimburse to patients based on the items. Now, Chinese public medical insurance system is reformed into diagnosis-related group mode, which can be abbreviated as DRG mode. Specifically speaking, patients will be divided into different groups based on their personal information and disease stages. Each group of patients have its own limited budget. In other words, how to make the most of drugs will be important to reduce cost and increase benefits to hospitals indirectly. Nowadays, many drug-related tests have been covered by the public medical insurance, such as some pharmacogenomics tests for target drug. For big hospitals, they have their own laboratories to provide testing services. However, not all hospitals can afford such testing services, especially for those small hospitals. Therefore, many companies will cooperate with these hospitals to complete tests. TDM pharmacists are responsible to interpret drug-related test reports, like pharmacogenomics report, to related departments and provide associated suggestions. Even though their jobs are overlapped with clinic pharmacists, they are necessary now to meet the clinic pharmacist insufficiency. The government set up a specific group from handling COVID-related problems. It recruited 5 commercial companies to supply drugs for hospitals. Pharmacists should purchase drugs every 10 days, and they also would order drugs for urgent use each day. They also made most of software platforms to connect it with patients and provide pharmaceutical services. That's all my speech. Thank you.